For 12 years, every single morning began the same. She would open her eyes and freeze because she knew what came next. The moment her feet touched the ground, the pain would hit, sharp, blinding. Crying wasn't a choice. It was automatic. Not because she was weak, but because the pain felt like her spine was being split in half. Her name is Marissa James, a wife, a mother of two, a woman who once loved hiking, dancing, and running barefoot across her family's farm in Nebraska. But all of that was before the pain took over. It began after what seemed like a harmless car accident. No broken bones, no serious injuries, just soreness. The doctors said, "You're lucky." But what they didn't see was what started happening inside her body weeks later. First, it was the ache in her lower back. Then, the stiffness. Then, the burning. Then, she couldn't stand for more than 5 minutes without holding her breath. Medication became a way of life. Appointments became routine. Hope became harder to hold on to, because each time she got her hopes up, each time a new pill or therapy seemed promising, it failed. Every night, she would tuck her kids into bed with a smile, then lock herself in the bathroom and cry into a towel so no one could hear. 12 years. That's 4,380 mornings of pain, 4,380 nights of dread, and 1,000 ways to lose yourself in the process. Until one night, just past 2:00 a.m., Marissa typed 6 words into a chronic pain forum. "Has anyone found real relief?" She didn't expect a reply, but someone did reply. A complete stranger. Not a doctor. Not a therapist. Just Ian. A man from Sweden. He sent one message. "I had your pain. I beat it. It's not what you think." What he shared wasn't a miracle cure. It wasn't a drug. It wasn't even a treatment. It was a perspective, a method, and a brutal truth that changed everything. What he told her would go against everything she had been taught, but it worked, and it gave Marissa her life back. This is the story of Marissa James. She's 36 now, a mother of two, living in a quiet corner of Nebraska. But when her story really begins, she was just 24, newly married, energetic, alive. She had dreams of opening a dance studio, something small, something hers. She spent her weekends hiking with her husband, laughing too loud, and dancing barefoot in her kitchen. Life was simple and good, but everything changed on a rainy Friday in October. A minor car accident. Not her fault, just a quick stop at a red light, then a jolt from behind. Her head whipped forward, her back tightened, but the ER said it was nothing. No fractures, no tears, no real damage. Just some soreness, some painkillers, and advice to rest for a few days. She followed the instructions, took the pills, slept it off, tried to go back to life. But something wasn't right. A week passed, then 2, and the pain didn't fade, it grew. It started in her lower back, a deep, twisting ache. Some mornings, she couldn't sit up. She had to roll sideways out of bed and push herself upright using the wall. She told herself it was temporary, that the doctors were right, but by the 3rd month, she knew they were wrong. Her once active life, gone. She stopped hiking, stopped dancing. She couldn't even pick up a laundry basket without wincing. By the 6th month, she was struggling just to walk from her bed to the bathroom in the morning. The physical pain was relentless, but it was the emotional toll that began to suffocate her. Because chronic pain doesn't just hurt your body, it changes your identity. And Marissa? She was slipping away from herself. In just the first year alone, Marissa saw 9 different specialists, general practitioners, neurologists, orthopedic surgeons. Each one poked, prodded, scanned, MRI after MRI, X-rays, CT scans. They all came back inconclusive. One doctor said, "It's nerve damage. You'll need lifelong meds." Another said, "It's psychosomatic. Maybe stress or unresolved trauma." The worst one? He barely looked up from his clipboard when he said, "You're too young for this kind of pain." So Marissa kept searching. She tried everything. Physical therapy twice a week for 3 months. Nothing. Acupuncture 5 sessions. No change. Cupping, yoga, cryotherapy, diet changes. Still nothing. Then came the cortisone injections, long needles deep into her spine. The pain got worse before it got better. And then, it didn't get better at all. Every failed treatment felt like another door slamming shut. And the pills, they began stacking up. Muscle relaxers, opioids, nerve blockers, sleep aids. At one point, she was taking 6 different medications a day, just to function. And even then, she still cried brushing her teeth. But the hardest part wasn't the pain. It was the judgment. Friends who didn't understand, co-workers who quietly assumed she was lazy, family members who'd say, "But you don't look sick." She stopped trying to explain, stopped talking about it altogether. She became a master of hiding, smiling at birthday parties, laughing at the school pickup line, and then collapsing at home, face buried in a pillow, screaming into the silence. The shower became her place to cry, her only moment alone, steam hiding her tears, pain washing down the drain, at least for a minute. Depression crept in. So did anxiety. And guilt, so much guilt, for being an absent wife, for being a tired mother, for being unable to do the simplest things. Marissa was losing herself, one layer at a time, one day at a time. And she wasn't alone. In the United States, over 50 million adults live with chronic pain. Many of them suffer in silence, their pain invisible, their struggle dismissed. It's a quiet epidemic. And for Marissa, it was swallowing everything she used to be. It was 7 a.m. Marissa hadn't slept in 36 hours. She'd tossed, turned, tried breathing exercises, tried lying flat, curling up, stretching. Nothing helped. The pain wouldn't let her rest. Her mind wouldn't stop spinning. That night, in a moment of exhaustion and desperation, she picked up her phone and opened Facebook. Not to scroll, but to search. She typed in, "Living with chronic pain." And there it was. A private group with 12,000 members. She clicked, join. She didn't expect to be accepted right away. But 5 minutes later, she was in. She didn't plan to post anything. She just wanted to read. To see if anyone else felt like her. But after scrolling through dozens of posts, stories that mirrored her own, she couldn't help it. At 2:29 a.m., she typed, "Hi, I'm Marissa. I've had lower back pain for 12 years. I've tried everything. Doctors think I'm exaggerating. My family doesn't understand. I'm tired. I just want to live again." She hit post, then immediately regretted it. She almost deleted it. But before she could, a reply appeared. His name was Ian. He lived in Sweden. He wrote, "Hi, Marissa. I had the same pain for 9 years. Nothing worked. Until I found something no one talks about. I'm not a doctor, but it changed my life." Marissa stared at the message. Skeptical. Curious. What could he possibly know that her specialists didn't? Then he said 4 words. "Look up McKenzie Method." He sent her a link to a 5-minute video. The thumbnail showed a man lying face down on the floor, slowly lifting his chest upward, something like a push-up. It looked too simple, too gentle, Ian warned her. It'll hurt at first. That's normal. But keep going. Trust your body. Don't force it. Don't give up. No big promises. No miracle cure. Talk. Just quiet encouragement. From a complete stranger. Marissa saved the video, turned off her phone, and cried. Not from pain this time, but from the strange, unexpected feeling of being seen. He didn't doubt her. He didn't dismiss her. For the first time, in a long time, she felt a spark. Not hope exactly, but possibility. The McKenzie Method, also known as Mechanical Diagnosis and Therapy, MDT, is a system of assessment and treatment for musculoskeletal disorders, especially back, neck, and extremity pain. Used for low back pain, sciatica herniated discs, neck pain, shoulder, knee issues, in some cases. The McKenzie Method is usually carried out by an initial assessment which includes self-reporting. The first step is for the patient to describe their symptoms and the history of their pain. This includes how the pain started, its nature, and what aggravates or relieves it. Movement testing. The therapist will guide the patient through a series of movements, typically starting with forward and backward bending, twisting, and lateral movements. The goal is to identify patterns in how movement affects the pain. Postural analysis. The therapist will assess posture to identify any imbalances or incorrect alignment that might be contributing to pain, followed by classifying the pain, choosing treatment technique, self-treatment, progress monitoring, and finally prevention, which is done once the patient's pain is under control. The McKenzie Method, it then focuses on prevention. This includes maintaining correct posture, avoiding overuse, and continuing exercises to prevent future episodes of pain. The next morning, Marissa made the decision she would try. Before the kids woke up, Marissa rolled out a yoga mat on her living room floor. She pulled up the video Ian had sent. It was just 5 minutes. No music, no big speech, just quiet instruction. She laid face down, elbows under her shoulders, and pushed up, slowly. The pain came fast, hot, sharp, like knives digging into her lower spine. Her arms trembled, her breath caught. Every instinct screamed, "Stop!" But she remembered Ian's words. Don't force it. Don't give up. So she didn't. She lowered herself gently back to the mat. Waited. Tried again. That first day, she managed just 2 reps. That night, the pain flared even more. But she did it again the next morning. And the next. By day 4, something changed. She got out of bed and didn't immediately wince. She stood taller, walked to the kitchen without leaning on the counter. She thought it was a fluke. But the change stuck. She added a few more reps each day, watched more videos, joined an online McKenzie group, asked questions, took notes, listened to her body. And slowly, over the course of weeks, Marissa began reclaiming her life. She started sleeping through the night, stopped needing pain meds every morning. She laughed again, real laughter, not the forced kind she used to hide behind. By the 3rd week, she walked a full mile with her kids. By the 4th week, she danced at her daughter's 6th birthday, barefoot, spinning in circles, pain-free. For the first time in 12 years, she wasn't just enduring life, she was living it. The McKenzie Method classifies pain into 3 main categories. 1. Postural syndrome. Pain caused by poor posture, typically relieved by changing positions. 2. Dysfunction syndrome. Pain due to mechanical dysfunction in tissues that have been shortened or scarred. 3. Derangement syndrome. Pain caused by internal derangement or displaced discs in the spine, typically resulting in limited range of motion and severe discomfort. The therapist will use the patient's responses to determine which category their pain falls into. Marissa never met Ian in person, but they still message, checking in, encouraging each other. Two strangers connected by pain and by hope. Marissa's story didn't begin with that message from Ian. It began with a slow unraveling, a quiet, invisible storm that crept into every part of her life. Marissa's days became centered around her pain, how she sat, what shoes she wore, whether she had access to heating pads or pain creams. She kept emergency meds in her purse right next to her kids' snacks. She stopped sleeping through the night, stopped traveling, stopped trusting her own body. Her partner tried. For the first year, he rubbed her back, cooked dinner, managed school drop-offs. But as time wore on, so did his patience. He didn't understand why Marissa wasn't getting better, why the MRIs didn't show more, why she looked fine but kept canceling plans. Friends invited her out, less and less. She missed baby showers, birthdays, concerts, until the invites stopped coming. At work, she wore flats and smiled through meetings. But she took painkillers at her desk, closed the office door to cry between calls. Doctors gave her scans, meds, and vague diagnoses. Some believed her, some didn't, but none could help her. And over time, they stopped trying. Appointments grew shorter, the room colder, the silence heavier. There were days she looked in the mirror and didn't recognize herself. She wasn't the mom who ran in the yard. She wasn't the woman who dreamed about hiking in Costa Rica. She was just someone trying to get through the next hour. And yeah, she kept going. Not because it wasn't hard, but because quitting wasn't an option. Because her kids still needed lunch. Because even when her body gave out, her heart hadn't. A key principle of the McKenzie Method is centralization, where pain that radiates, e.g., into the arms or legs, moves toward the center of the body. Patients are guided through specific movements to encourage centralization of pain, which is considered a positive sign of progress. Patients perform repeated movements, often based on the patterns identified in the assessment. These movements are designed to reduce pain, restore function, and prevent further injury. They might include extension exercises for pain caused by flexion, such as disc issues, flexion exercises for pain that improves with bending forward, side gliding movements for lateral pain. The therapist teaches the patient how to maintain proper posture during daily activities, sitting, standing, and walking. With her pain now manageable, Marissa decided to help others. She trained as a rehab coach, taking night classes while still doing her stretches each morning. She learned anatomy, movement science, and most importantly, how to listen. Then, she launched an online support group, a quiet space for people with invisible illnesses. No judgment, no toxic positivity, just real talk, shared resources, and someone finally saying, "Me too." Within 6 months, the group had hundreds of members. People from across the country, some across the world logging in, just to be heard. Marissa didn't claim to be a doctor. She wasn't trying to fix anyone. She was just offering what no one offered her in the beginning: validation, hope, a place to begin again. She partnered with physical therapists collaborating on pain-friendly routines. She started a YouTube channel, posting short videos like tips for managing flare-ups, neck stretches you can do in bed, and how to explain chronic pain to your boss. Bit by bit, people listened and responded. Then came the invitation to speak at a local medical school, not as a case study, but as a teacher. She stood before future doctors, told them what it felt like to be dismissed, to be called dramatic, to cry behind a closed bathroom door. And they listened. Some took notes. One student cried. Afterward, a young woman approached her. She said, "My mom's been in pain for years. I never understood her until today." That night, Marissa sat in her car again, But this time she wasn't numb. She wasn't broken. She was proud. For the first time in 12 years, she wasn't scared of the future. She was building it. 12 years of chronic pain. 19 treatments. 9 specialists. Hundreds of tears. One stranger and one video changed everything. Not because it was easy, but because Marissa didn't give up. She found the strength to keep searching, to keep trying, and to keep hoping even when it seemed like no one else understood. Once the treatment is established, patients are encouraged to perform exercises at home regularly. The McKenzie Method emphasizes self-care, where patients learn to manage their symptoms and make adjustments to avoid future flare-ups. Patients are educated on how to make adjustments to their posture during everyday activities to reduce strain on their spine and muscles. Her story is proof that healing isn't always found in a prescription bottle or a doctor's office. Sometimes, healing starts with a single moment, a small decision, a shift in mindset, and someone out there who's willing to care enough to share their journey. If you're in pain today, know this: you're not crazy, you're not broken, and you're not alone. There is help, there is healing, and sometimes it starts with a story. If Marissa's journey resonated with you, we'd love to hear your thoughts. Leave a comment below. Share your own experiences, or offer a word of encouragement for those who need it most. If this story inspired you, give it a like. And don't forget to subscribe for more true stories that bring hope and healing. You never know. The next story you hear might just be the one that changes your life.